All right, we're going to begin session 2. We have several excellent presentations to help set the stage as we begin this conference. So first up, I'm going to introduce our first speaker. Our first speaker is Dr. Les Sims. I think most of you probably know Les from his work over the last 25, maybe closer to 30 years, working with many animal health issues in Southeast Asia and Australia. Dr. Sims is a veterinarian. He got his degrees in Australia. For the past 18 years, he has provided advice and services as a consultant to the United Nations Food and Agriculture Organization and through FAO to a range of countries in Asia on avian influenza control and prevention. This has included assisting in designing appropriate vaccination programs against avian influenza. Les also is on the AFLU steering committee and technical committee for this meeting. So he's had a large hand in helping get this organized and for us to get our thought process about what are the issues, and let's try to discuss those issues. So Dr. Sims will give his presentation on factors that inhibit usage of preventative vaccination and ways to overcome them. Dr. Sims.
Thanks very much, David. It's a pleasure to be here. This meeting's had a very long process of development, and it's so great to see everybody here. And I'm so looking forward to getting the inputs from the people here. I've been working closely with African swine fever recently, and the one key message there is community involvement. You're the community. We need your involvement in getting these solutions. You know what's going on in your situation. We can only provide the directions for this. My talk today is about the factors that inhibit usage of preventive vaccination. And these are the sorts of things that we're having to deal with at the moment. And one of the things we see quite often when we're talking about vaccination is there's some language issues. So if you read that headline, Wrestling with Bird Flu, Europe considers once taboo vaccines. Well, what message does that send? If you're talking about taboo vaccines, it sounds like there's something evil about vaccination, that you shouldn't be using it. But in fact, that's not the case. And you'll see this in quite a lot of the discussions we have on, or articles we see on vaccination, that this message that we should not be using vaccination comes out because of all the problems. And what we've been seeing over the years is that we often see that the barriers to vaccination take on a much greater importance than the benefits that vaccination gives. And we also see that headlines like this, where trade bans limit appeal of avian influenza vaccines. That's true at the moment, but there is no reason that has to be in place. It's a case of finding the solutions around that, especially if more places are using vaccination. But there is no logical reason why we can't design systems that allow us to make sure that places where a vaccine is being used in a way which retains a zero tolerance for infection. And we can design systems that do that. So that's the basis of my talk today. A bit of background. 20 years ago, I was based in Hong Kong, and we'd basically done all we could from a biosecurity perspective to enhance enhance our protection, and we still weren't doing enough. We were still getting virus coming in through poultry coming in both from mainland China and in Hong Kong. And so we had to look at other ways of preventing this infection from occurring, and that's when we turned to vaccination. So for 20 years, Hong Kong has been using vaccination as a preventive measure for avian influenza. It's not endemic there. Throughout that time, there's been one outbreak of avian influenza in 2008. And the rest of the time, a very intensive monitoring program has demonstrated that the virus is not endemic. And so we don't have the so-called silent infection that people worry about. So this presentation is based on observations there. And it's also based on my experience in other countries, which are places like Vietnam, Myanmar, Cambodia, places which sometimes do and sometimes don't use vaccination. But what's important here is that we don't take the results from those countries where the virus was endemic and apply them to countries which will have a zero tolerance for infection. So places where vaccines being used as a preventive, where the virus is endemic, did so because they could not find all cases. They could not have surveillance systems in place to monitor every single vaccinated flock. It was just impossible given the resources they had. So by all means, learn some lessons from those places, but don't try to equate the lessons from places like China or from Vietnam or Egypt or Bangladesh and apply those to Europe and North America. Because if you're using vaccination, you're going to have a completely different situation. Now, David presented this slide of mine, which includes the various barriers, and I won't go through all of these in detail because it would take me too long to do so. I'm going to focus on just a few of those to just come up with reasons why they're a concern, why some of these concerns are overrated, and also looking at what are some of the solutions to the ones which still exist. And the first one of these that everyone talks about is that vaccination will lead to silent infection and shedding of virus. And this is based largely on the fact that in many cases, when you do experimental trials for vaccination, you will find that some birds will be completely protected and they will not shed any virus when they are challenged. But in most cases, you're going to get a reduction in shedding, not a complete prevention of shedding. So from those sorts of challenge studies, it makes sense to suggest we could well get silent infection occurring on a flock basis. And several models predicted that we would get silent infection in vaccinated layers. So there was a paper that came out by Saville and others. So this paper down the bottom left-hand corner here was a model that was never ever field validated. And it doesn't match what happened in the field in Hong Kong when in fact vaccination was used. And the case that David talked about in North America, where the low path virus was essentially stopped from spreading. So the trouble is, we read the heading and it talks about silent spreading, and people have actually cited this paper many, many times, but it must be recognized that this was never ever field validated. And in fact, this was the case, this was published, the situation in Hong Kong was published by this paper by Trevor Ellis, which you can see there, in which vaccination stopped a high path outbreak when they had no other way of dealing with that. A bit like David's situation with the no indemnities. There were no indemnities for these farms, and so they had to use a different method rather than stamping out to control it, and vaccination was used. I'd also used vaccination in 2002 in an outbreak and had found that it also stopped transmission of virus within farms which were known to be infected. Now, there are some papers do appear to report on silent infection, so it can occur. But sometimes we have to be careful about how we interpret these papers. For example, the one in the bottom corner here talks about silent spread of HPAI in vaccinated commercial layers. What it doesn't say is these birds had very low antibody levels when they were vaccinated, and they were single vaccinated one time, and that the results show that they serologically converted. So there's also the case from Ma and others from China, and that was with a very marked antigenically variant virus of clade 7.2, and clade 7.2 tended to behave differently to other viruses. So when you're reading these papers about silent infection, please read them with care and make sure they don't get overinterpreted. And it's when you start looking at vaccine trials with transmission studies involved in those, so where you take a group of vaccinated birds and challenge them, and then add vaccinated birds to those challenged birds, that the situation changes. And what you often find in those situations is that you do not get transmission. Even though there's some shedding, you will not get transmission occurring from those, but from one batch to another. And this has been reported from a few studies. There's not many vaccination studies use this methodology because it obviously increases the complication of the trials. But when it's been done, the results have shown that we don't necessarily get transmission occurring. I'll be referring to one paper in particular, one in the bottom left-hand corner there by Sitaris and others. It was done at FLI. And this involved a series of groups of birds that were vaccinated with either high level vaccination, or in some cases with vaccination that generated very poor immunity. And what I'm going to show you is two batches of birds from that trial. So each of these tables shows the top 5 birds are vaccinated contacts, the bottom 5 are challenge birds. In this particular case, and I'll show you a larger scale version of that, the top 5 birds, the bottom 5 birds had virtually no titers to the challenge strain. So, oops, sorry. So if we look at the, if you look at that, the HI titers for these birds were very, very low. And you'll see on the right-hand side there that you'll see the red crosses next to all of the vaccinated challenge birds. They all died, but they also shed virus. So any areas which are grey shaded are days in which these birds were shedding virus. So these birds in the bottom 5 birds, which are vaccinated challenge birds, were all shedding virus before they died. And that then transmitted to the other birds, which also died. This was not silent infection. So what I'm arguing here is that when you get a situation like this, where you have a large amount of virus being shed, it won't be silent. You'll actually see some mortality occurring in the shed. The alternative was this scenario where a number of the challenge birds did shed virus, but you'll notice that the birds to which they were put in contact, they're also vaccinated. There was no transmission or shedding by those birds. So what this basically shows is that even though there was some degree of shedding, it wasn't enough for the virus to then continue to transmit through the flock. And this matches what we've seen in the field situation where vaccination has been used in the face of outbreaks. It matches the situation we've seen with vaccination programs where the amounts of virus reduce considerably because there's just not the degree of transmission. And what this to me leads to is that we need to be starting to think about the way we consider vaccinated birds. And this was not just one trial. There are other trials that have been done, one by Van der Gut, which was done in using a H7 virus, which also showed similar results. There's been similar results shown with HPT vaccination as well. So a well-vaccinated flock, and what I mean by a well-vaccinated is one with good immunity and a close immunity or close matching to the field strain, actually represents a very low probability of becoming a flock with sustained infection. That's a real change. At the moment, we think about vaccinated flocks as being somehow more dangerous. They're not. So I think we've got to change the way we think about vaccinated flocks and consider a well-vaccinated flock to be a very low risk. If you're doing a risk assessment, I would put these flocks at a much lower level compared to, say, a flock of ducks, which is not vaccinated, which can also be silently infected. So think about the way we consider these flocks. Think about vaccination as being a way of improving the level of protection and reducing the amount of virus which will be shared and the chance of transmission occurring in those flocks. And we need to exploit this in the way we think about the risk posed by well-vaccinated flocks. But it also means when you're doing your surveillance, it's a good idea to do sufficient surveillance to monitor the serological response to make sure the birds are responding to vaccine, perhaps include some cross-matching studies to make sure your strains that you're being exposed to are going to be protected by those antibodies. But it means you can then focus more of your attention on less well-vaccinated flocks using more targeted surveillance. So my sense is that true silent infection probably occurs rarely. You will get, I'm not saying you won't get infection in vaccinated flocks, but in most cases, where you have high level immunity, your R value is going to be so low that you won't get onward transmission. If you do get transmission, then you're going to see some signs of mortality. It won't be at the same level you saw in an unvaccinated flock, but you will see some dead birds if you're dealing with galliforms. And the way around this issue is to use routine dead bird testing. as one of the methods for finding infection in a vaccinated flock. And I think it is by far the most sensitive indicator for detecting when something is going wrong. This is not necessarily after you've seen a sign of increased mortality, but by using just routine dead bird testing, you will be able to pick up infection in a vaccinated flock much earlier. Now, other ways you can think about this is you might see change in serological profiles. So if you are getting silent infection, then you may start to see changes in your serological profile. So if the birds have not been vaccinated again, but you're starting to see increases in titers, that may be another way of monitoring for infection in these flocks. And I think the other thing where we're talking about detecting infection in flocks, we need to take some of the lessons from COVID-19. And you've noticed with COVID-19 how much use has been used of wastewater examination and PCRs on wastewater to find infection in areas before you actually find an indication of infection from case reports. Now, I'm not saying we use wastewater for poultry, but we use the similar methods and look at different ways of using environmental samples to improve our surveillance. The idea of going in and swabbing lots of birds is fine, but it's also relatively insensitive because if you've got, say, 5% of birds infected in a flock, which would be unusual without seeing some signs of disease, it's a lot of work to go in and take all those samples and get them tested. If we look at vaccination studies from elsewhere, this was a group of studies published from Egypt where they used 8 different vaccines against an antigenic variant strain. And 5 of the 8 vaccines, you will see that they actually had mortality in the birds that were challenged. So again, this was not a case of silent infection. The 3 vaccines that worked were ones which were closer antigenic match. Some of those birds were shedding virus. There was no transmission study done in this, but the fact is that in most situations where you have a vaccine which is a poor match, you're going to get mortality in these birds, again, suggesting silent infection may not occur very often. Now, the other one that comes up quite frequently is that vaccination will result in selection of antigenic variants. And we recognized this very early. In 2004, we had a meeting on surveillance for avian influenza when we first started talking about using vaccination. And it was like all influenza viruses, we expect you're going to get antigenic change over time. And some of that could be driven by vaccination. But the extent to which you get this happening depends on the extent of infection you're getting in birds. So if you have well-vaccinated flocks and very minimal challenge to those flocks, you are not going to generate antigenic variants quickly. We tend to get antigenic variants occurring where you have flocks which are vaccinated and also being exposed to large amounts of virus. We've also got the situation where in some countries, it's not so much you're getting a new antigenic variant forming in that country, but you're getting the strain being imported from elsewhere. So in Indonesia, for example, clade 2321C was imported after and replaced the original strain that was present there. That strain was obviously not well covered by the vaccines in use, and they had to then change their vaccination program. And Henry Wababa will talk about this later on when he's talking about Indonesia. Vietnam, a similar situation where multiple new strains have come in. And in Vietnam, we saw that down in the southern part of Vietnam, the vaccines they were using there against clade 1 viruses functioned perfectly well for over 5 years without having a need to change. But we are seeing, I'm not downplaying the fact that antigenic variants will occur. They will occur, and they're going to occur most frequently in places where we have the situation where vaccinated birds are being exposed to large amounts of virus. So this is probably what happens in places like sometimes in Egypt, sometimes in places like China, and especially in places where you have lots of birds going through live bird markets with mixing and matching of birds and lots of opportunities for infection to occur. So we've known this is going to happen. We have to now find solutions for that. And that means detecting and responding to these antigenic when they arise. So having programs such as the one that Maduro has been talking about earlier and today about the off-flu program for antigenic determinants is one way of doing this, but this will only work if we get access to new strains. We need to have a fairly broad global approach to this to make sure we can find these antigenic variants early, so you have some chance of being able to match your vaccines to possible invading organisms. We also need ways to update vaccines more rapidly. And David talked already about cassette methods where you might be able to change your antigen. But we also have to remember that a lot of avian influenza vaccines offer quite broad protection across a range of strains. So just because you have some degree of antigenic variation does not mean your vaccine will still not work. But it's important if you start identifying antigenic variants to start doing that sort of testing. The big one, vaccination prevents trade. And at the moment, yes, it does. And that's because no one's prepared to take that first step. And this is where the people in this room are the ones we have to talk to and get your ideas and ways around this issue. There is nothing from a technical perspective, and my colleagues will be talking about this later, that says you can't trade when you vaccinate. But it's still the big barrier. Everyone is frightened if they start using vaccine, their trading partners will not accept their birds. But if you have an appropriate surveillance system in place, there's no reason why that has to be a factor. Now, there may be some countries who, despite all of the rules and the regulations, will still decide to do that. We have to continue to convince them that it is not necessary or essential to do that if the program in place is suitable. So you should only be inhibiting trade if there is not an appropriate surveillance system in place to demonstrate that infection is not occurring in vaccinated birds. But this is, again, every time I talk vaccination to people, this is the first thing that comes up. We can't do it, it's going to stop our trade. Well, let's get over that. This room has the power to start making those changes, but it's got to be everyone working together to push this forward and say, why? Why aren't we going forward? I get very frustrated watching what's happened in the world over the last 2 years and think, why hasn't vaccination occurred already? I can't cope with seeing 40, 50 million birds dying in 1 year when there are methods which could be used to stop that from happening. And I think we owe it to ourselves to try and make sure that doesn't keep happening. There will be, some people will say that you'll have to test all vaccinated flocks if vaccination is used. And that is probably still going to be the case if vaccination is used in, say, North America and Europe, that the demand from your trading partners will be that you are demonstrating that every flock is not infected. That creates problems because clearly getting every single flock tested on a regular basis is expensive. You may not have the testing resources and other things, but we have to find ways to do that. It's important that we just look at the options we have available. And again, that comes back to, are there novel ways we can do surveillance which do not rely on massive amounts of testing? Can we change the frequency of testing? And again, my colleagues here will be talking about some of these issues later on. But the thing we learned from Hong Kong, and Jeremy Ho will talk about this later on in his panel discussion, is that a multi-layered system can help you. For example, if you're dealing with turkeys and all turkeys are vaccinated, you could use turkey slaughterhouses as one point for testing your system by taking environmental samples from your slaughterhouses to see that there's nothing happening. And then, of course, trying to feed back to find out where that virus might have come from. But that's on top of what you're doing with your farms. So a multi-layered system would include things like serological response to vaccination to show birds are responding. It would include virological testing to make sure that that there is no virus circulating. Again, using methods which are most appropriate. And we've got some work to do here. We may have to develop different systems for developing surveillance, but let's think again, these issues will come out in our panel sessions and working groups over the next 2 days. It's got to be affordable. If it's not affordable, people are not going to do it and people will not vaccinate. So we have to look at how we can balance this, the cost of surveillance versus the accuracy for detecting sustained infection in a flock. And maybe we have to explore options that don't rely, we have, private partners doing some of the work. We do this with a lot of the slaughterhouse management these days, where it's not the government person who goes and inspects things. It's done on a contract basis by somebody else. We need to get the private sector involved in this, working with government to make sure that the testing can be done in a way which is obviously ratified and verifiable. But government labs can't do all this work, and government personnel will not be sufficient to do all of the necessary work to do surveillance programs in many situations. And the other thing is we've got to make sure vaccinated flocks are not disadvantaged compared to unvaccinated flocks. We know that duck flocks, for example, can be infected silently, but will they be exposed to the same degree of testing the vaccinated flock? Again, if I had my money, if I had a vaccinated duck flock and an unvaccinated duck flock, I would spend more time doing my surveillance on the unvaccinated flock than the vaccinated one, because I think that the unvaccinated flock is a much higher risk. We've also seen with the clade 2344B some apparent silent infection in some broiler flocks. So it's important that we don't disadvantage vaccinated flocks, especially where we have infection occurring, which appears to be silent. And Tim Hard will be talking more about surveillance in his later presentation. Now, the other one, which is a barrier, and it still is a barrier, is that suitable vaccines are not available. I say it's a barrier because at the moment, most of the vaccines which are being produced and used, as David showed, are coming from China. And for various reasons, they may not be suitable for use in other countries. Usually for essentially biosafety, biosecurity reasons. But it's important to recognize that a lot of the vaccines which will not be considered, including non-DIVA compatible vaccines, have been used. And we use non-DIVA compatible vaccines in Hong Kong because we also had lots of infections with H9N2. And so any DIVA system that relied on looking for just an influenza non-structural protein just gave hundreds of positive tests. So we couldn't use that. Neuraminidase testing is not really the answer, but we still managed to put in place a surveillance system that demonstrated infection was not occurring. So just be aware that we talk about DIVA testing as if it's something we have to do. My sense is we're better off going for virological surveillance than serological surveillance. It gives you a real-time indication of what's happening in the flock. And we have so many problems with DIVA testing in terms of cases where flocks test positive. You still have to go back then and try and work out why they're testing positive. You may then have to go back and do virology anyway. Now, I'm not saying don't use DIVA testing, but just recognize its limitations. So the commercial reality is no one's going to produce a vaccine unless there's a market for it. And we have this circular problem that there's no market at the moment. So getting around this problem is something I'll leave to the manufacturers later, but it is a massive issue. And we have to recognize that some people got burnt back in the early 2000s producing new vaccines, which never found a slot in the market. So we have to make sure that we have that. Again, we need to find ways to rapidly update vaccines. This might be easier when we start talking about using mRNA vaccines rather than killed antigen, but both can be done. And we might have to think about other types of vaccines that don't require fertilized eggs, given the difficulty in getting sufficient eggs to produce the amounts of vaccine that we need, especially if we're talking emergency programs. So that means mRNA or even plant-based, plant-produced vaccines, which have been used in South Africa in the past. Clearly, there are concerns. If I'm sitting here today or let's just say I was sitting here in 2016, 2017, and there's a new virus coming, I want to be sure I know what the antigenic characteristics of that virus are before it gets here. So it's important we have these programs in place, like the off-loop program we're talking about, but also having the capacity to have good intelligence. And this particular Empress watch that came out picked up on these viruses in TB in 2016 and allowed some degree of early warning. Now, is that enough? You're only getting a few months' notice, but at least it's better than no notice. Now, just a few notes on a few of these other barriers. There's people always say that if you use vaccination, it's going to cause endemic infection. I've already talked about the Hong Kong situation, and also that most places where vaccination has been used in endemic countries, the virus was already endemic. When I was in Vietnam in 2005, they'd already killed something like 30 million head of poultry and had not gone anywhere near anything close to eradicating the virus. The shift to vaccination was very logical. The shift to vaccination was necessary to prevent human cases, and the shift to vaccination worked in reducing the loads of virus and stopping and essentially allowing the country to live with avian influenza, which otherwise it was not able to do. As I say, Hong Kong has not had endemic infection despite using vaccination for 20 years. People say, well, let's just stick with stamping out. And we've already talked about some of the cons of stamping out. And again, your industry suffers every time you have to do mass stamping out. The image of your industry suffers because of the fact that you're having, there's people who do not like the fact that you're having to cull animals to control a disease. Where there's a solution to that, I like to see it would be implemented. But if you're using vaccination, you're going to find you'll have much fewer cases where you need to stamp out anyway, because you've got this increased resistance of birds to infection anyway. The likelihood of having to stamp out flocks will reduce if you have a well-vaccinated population before the virus arrives. That's not saying you won't be using stamping out. If you find a flock which is infected through your surveillance program, or you're both passive and active, then of course you will still be using stamping out to control the virus in those flocks. But you will find you'll be using that far less frequently if you use vaccination. People talk about having an exit strategy, that's fine, but let's change that to a review strategy. My sense on vaccination is you vaccinate for as long as it's necessary. If the situation changes, then you stop vaccinating, if that's sensible. But let's just talk about a review strategy rather than saying we must stop vaccinating on a certain date or a certain time. If the wild bird situation continues, then what is your exit strategy there? I think you'll still probably be vaccinating for as long as those wild birds are posing a hazard to your farms, because biosecurity is not enough to prevent it. Some people say if we use vaccination, it means farmers will stop using biosecurity. Well, yeah, it could happen, but we're not just dealing with avian influenza, we're talking biosecurity. There's hundreds of other diseases we're trying to control apart from avian influenza. And people also, so this can be managed. And there's also the fact that people say farmers won't report disease. If you've got a decent surveillance system in place, you're going to find the virus. And so farmers won't be able to hide for very long anyway, because they'll be found out, because the surveillance system will be such that you won't be able to hide the infection. I won't talk much about public health, but again, I just wanted to point out that the situation here with H7N9 vaccination in China, that arrow there points to when vaccination was introduced against H7N9. And up to that, all these other peaks here are the human cases which occurred. After vaccination was introduced, human cases essentially disappeared. That's a fairly compelling argument that vaccination can reduce the risk associated with avian influenza. And again, it makes sense. If you're vaccinating, you're going to, even if a flock gets infected, the amount of virus which is produced is markedly reduced. So you're going to have less exposure of people. So those workers going on to do depopulation on a vaccinated flock which breaks down will not be exposed to the same quantities of virus as someone who is going onto a flock which is completely unvaccinated, where there's plumes of virus in the air where they're working. And there's been questions saying, oh, if you vaccinate, you're going to get increased reassortment of virus. I'm never quite sure how that one came about, because if you're vaccinating, you'll get less virus, and reassortment happens when you get multiple viruses occurring in the same flock. Clearly, if silent infection was occurring, that might be a case, but I find that a rather spurious argument for not using vaccination. And Richard Webby will talk about the public health aspects in a presentation shortly.
Can you wrap it up in about 2 minutes?
Sure. So the other barriers, people will say if you use vaccination, it inhibits efforts to eradicate the virus, but not if there's a well-designed system of surveillance in place to manage that. And again, we saw in Hong Kong that we could eliminate virus from Hong Kong using a combination of stamping out and vaccination, and it was kept that way. So let's just finish with some conclusions. A number of the supposed barriers are, in my view, based on false equivalence, especially with countries where the virus is already endemic and elimination is not going to occur. So we've got to make sure we have to listen to those stories and understand what's happening there. But what happens in Vietnam is not the same as what happens in the Netherlands or France or the USA. It's quite a different situation. We need to start thinking that vaccinated flocks pose a lower risk than unvaccinated flocks, and change this narrative around that vaccination is actually a good thing and will help you will reduce the amounts of virus which is circulating, and that the fact that we're very unlikely to get much silent infection. We need to recognize, as David pointed out, HPAI has changed. And so you're being bombarded by virus from above at the moment, from wild birds. Will that remain the case for onwards? We don't know, but there's every chance it will. If that remains the case, then I think there's every reason to increase your biosecurity by adding another layer using vaccination. So all of the barriers we've talked about can be addressed. Some will be harder than others, and some will take more time than others. And again, think about multifaceted ways of monitoring and targeting your monitoring and surveillance programs to make it workable, feasible, and affordable. It's a very powerful tool, vaccination. And I believe we're not using vaccination. We're not using all the tools in our toolkit to do that. If this were Newcastle disease, we wouldn't be having this meeting. I understand there's the other dimensions to avian influenza being the human health aspect. But why? It's just, to me, it seems amazing that we've somehow managed to inflate the negatives to the point where we're frightened to use vaccination when we have vaccines which can work in our toolbox and they're not being used. And so we need to rebalance the pros and cons of vaccination. So we think more about the positives, but also still think about the cons, but make sure we do things about them. So if we go back to my original slide here, I just put a notation on some of these. So these ones I've marked with an X, I think we can almost dismiss as being almost not relevant to our arguments here, because they're things which to me are almost spurious arguments about vaccination. The ones I've marked with M's, they're manageable, and we have ways we can manage those today. And there's two more which I've marked with an M with a question mark, which are the issue with finding suitable vaccines and also the trade aspects, which we need work to get systems in place to allow you to do that. But again, these are manageable. It just might take some more time to do so. So I'd like to thank you so much for your attention. The meeting for you has just started because I really want to see everyone in this room contributing to the issues I've talked about today to try and come up with solutions, especially for some of these thorny issues like trade and availability of vaccines. It's got to be, to me, vaccination should be considered something to help you get over the problems such as the headlines we have here. I don't want to see the end of free-range eggs year-round, and I don't want to see more headlines that say bird flu kills close to a record number of poultry in the US or in EU or other places. And I think vaccination can help you to get over that problem. Thank you very much.
Thank you, Dr. Sims. We're going to move on. We have another short section with two presentations in trade and poultry products from places where vaccination is being used. Our first speaker will be Dr. Etienne Bonbon. Dr. Bonbon is a veterinarian. He has served as a senior veterinary advisor to the FAO Animal Health Service Emergency Management Center for animal health since May 2017 until just recently. He also is the president of the OIE Terrestrial Animal Health Standards Commission since 2015. And before that, he served other various roles at OIE. Dr. Bonbon, the floor is yours.
Thanks a lot, David, and thanks, Leslie. I'll try very quickly, as quickly as I can, but of course, we'll have to stop on a few points to demonstrate that you are here also not only to learn about and discuss about the HPAI, but also to learn about and discuss the harmonization of the way we are naming things and the way we are dealing with the disease surveillance, disease status determination, and disease control. And I didn't see that in your presentation, Les, and I thank you for that. But I've heard maybe too often that the international standards were indeed a barrier for vaccination. And this is just not the case. The international standards are not here to forward or to push the members towards one or another way of preventing and controlling the disease. The international standards are here to avoid the disease to move from a country to another and to give tools to the countries to be sure that when they discuss, when they trade, they are transparent. Everybody knows the situation, and when they trade in good faith and be able to avoid man-made, let's say, movement of virus across continents and countries. So that's what I will try to tell you in a few slides. And I'll begin by generality and then talk about key aspects of the chapter in the terrestrial code, and then a few key points on HPAI vaccination that we can find in the chapter. So the chapter on HPAI in the terrestrial code was updated 1.5 years ago, so it's not a long time ago. So when I see people say, no, we should revise the code, it has just been revised. It has been a long work. It took 4 years for us, and thanks again for David to chair the other group that led to this new text. And it adapted a lot of things that were in the past chapter on the epidemiology of the disease, on the trade issues, and on the trends, let's say, and including the vaccination. And a lot of things were added on vaccination in this chapter that were not in the past one. And of course, the situation has evolved since then already, because we know the things that have happened in the last 5 years. And maybe some countries say, oh, it has evolved, so we should have the code evolve. But international standards cannot evolve as fast as the epidemiological situation. It's always a way to, it's a way to discuss, but to have some firm and, if possible, stable standards for the members to refer to, because if we change too often, then this uncertainty will not help the implementation of the standards in the country's regulations and in trade aspects. So the code is still relevant and has taken the situation into account, and it is here to give options to the veterinary authorities to build some programs for prevention and control of the disease. So if we need more, if there is a need for more, then it's up to the members to indeed come back to the OR and write the DG. Say we don't find in this standard the tools we need. So either in the code or in the manual, and as Monique was said, there's also everything in the manual for testing and for the vaccine production and control. So a few key aspects on the chapter. Before it was on all AI, and is really focusing on HPAI. However, H5 and H7 LPI also are included in the chapter, because as was showed by David, you can have some drift, and some LPAI H5 especially can become high path. And this monitoring and management of LPAI at the herd level is important for a good monitoring and control of HPAI itself. And when there is when the country or zone wants to be free, in the freedom, there is a surveillance that include also some types of monitoring for LP. But the chapter is really on HPAI. The case definition is on HPAI. And as was said again by David, the case definition is based on a test. So it has no link with clinical severity. So there can be HPAI not seen in clinical, and especially in the species or animals that are more resistant. So it's very important. The clear definition of the case will help the surveillance that the members with a good testing, let's say, possibilities and capacities can be very, very easily notifying the cases. The free status is not given by the OA. So it's a status that is self-declared by the state, by the country, the member country, and all on the zone. So there is no official recognition of the status by the OA. It requires a thorough surveillance, but of course we know why. We know why, because of the quasi-ubiquity of this virus now, and proven management. That means that we should prove not only that there is no case, but when there was one, when there were outbreaks, they were correctly managed. And from HPAI free zone, then there is conditions for trade that are specified in the chapter. And for the moment, there are no certificates to trade fresh meat or to trade live animals from infected zones. But in infected zone, you can have also free compartments. So you can have a trade from free country, free zones, or free compartments. And this is based on surveillance and management. But for the moment, from infected zone, only free compartment can trade meat or can trade live animal according to the certificates. So there is a possibility, but it's not written in, there could be possibilities for countries, but it's not written in the code. And for surveillance, it's what we call passive and active. I know these words are a little bit now obsolete, but we still use them. Passive and active surveillance is not only required to detect the disease in infected zone or infected country. It is already the case in free countries and zone. And it's important to say that because I link it to Leslie's presentation. Surveillance, there are some specificities of surveillance for vaccinated flocks or for vaccinated population or subpopulation. However, doesn't mean that there is more in terms of level or in terms of intensity. This is just the specificity of the surveillance is not the same. The way of surveillance is not the same, but the intensity of surveillance when there is no vaccination, it's still very, very important. So that's a few aspects of the chapter that you can find today that are a little bit different from the chapter before. And of course, but you've heard that maybe in other places, in other moments, and I'm going to repeat maybe some things, and maybe all of you have already read the code and know it by heart, but I want to highlight a few points which are very important. In this new chapter, because it's a new chapter, give it a chance. It's been voted and adopted last year. Vaccination against HPAI is considered an effective complementary control tool when a stamping out policy alone is not sufficient. So as said, we are not just dropping stamping out, because for this kind of contagious disease, stamping out is still one preferred option for outbreak management. However, it is considered effective as a complementary tool. Vaccination does not affect the HPAI status. So here we can answer those who say vaccination is a trade barrier because of the chapters of the code. It's wrong. Vaccination does not per se affect the HPAI status of a free country or zone, as long as the surveillance is done in accordance with the situation to demonstrate there is no virus circulation. vaccination is not something that is universal. And again, it backs the situation that were described by Les a few minutes ago. It is decided by the vet authority, and it depends on not only the epidemiological situation, not only of the production and the private sector type of production, but also on the vet services post capacities and on the capacity of the vet services to perform and to make surveillance and to have capacities to have the good vaccination strategy and good vaccination program. So the tests that should be performed are not different from the others to demonstrate the virus circulation. Now we use PCR, and that's one way to avoid the problems of having a vaccinated population. However, there is in the code one option that is proposed. It's not says that you should, it doesn't say that the veterinary authority should use, but the possibility of having sentinel poultry to enhance the surveillance efficacy, the surveillance effectiveness with this, and to maybe answer some doubts about the unseen infection in populations, in vaccinated population. Having sentinel poultry might heighten the surveillance power. So one point which is also important, that may be a barrier, but it is obvious that we are not going to put in the code things that are just proposed without any return from the people who are using these options, is that not only surveillance should demonstrate the absence of circulation of virus, but also the surveillance should demonstrate that the effectiveness of the vaccination program. And that's something that is important in the discussion that we have. It's true that vaccination itself is a tool. However, it has to be demonstrated to be a useful tool in the situation where it is used. Because in general, yes, it is, but every situation have a specificity. So every country should do its job. So that's the few points on vaccination that I wanted to highlight in the code. So there is no trade bans linked with vaccination. This is wrong. This idea should be wiped out from our heads. The code is not a factor to inhibit the usage of vaccination. This is also something that should be wiped out from our head. However, the code has some specific points in the chapter that links vaccination to different types of surveillance, and especially surveillance on the absence of circulation and the surveillance for a demonstration of effectiveness of the vaccination program. One other point also is about the exit strategy that Les was talking about. We talk about exit strategy in the chapter of the code, in the whole code for emergency, let's say methods or emergency measures, emergency vaccination, for example, but not for other types of control methods. I would like to highlight a few points on the code. It is not because there is one chapter on HPAI that is the sole chapter that should be looked at when trying to develop a program to prevent and control HPAI, because you have other important chapter, and there is really a complementarity between what we call the horizontal part of the code, the section 1 to section 7, and then in the section 8 until 15 in the section for avian disease, for example, is very important. This complementarity is important. So important chapters on surveillance is chapter 1.4, and on vaccination, chapter 4.18. There we talk about emergency vaccination, prevention vaccination, etc. How do we build a vaccination program? And no vaccination is possible without planning, without programmation, without a real bind between private sector and public sector, and without surveillance. Other important chapters are the one on zoning and compartmentalization, chapter 4.4 and chapter 4.5, because we know that with a disease like avian flu, which is not the endemicity of the disease is a little bit different from endemicity of other disease because of the implication of wildlife and this cycle that was shown by David. But the way of dealing with zoning and compartmentalization can help members and country to use vaccination with good biosecurity, good traceability, and good movement control. This is not possible to lay down and to propose a program for vaccination without that. And of course, a new important chapter that was also adopted very recently, the chapter 419 on official control programs. Thank you very much for your attention. Of course, we answer the questions after.
Thank you, Dr. Bonbon. Our next speaker is Dr. Moritz Klemm. And in your ebook, I'll just make sure everybody knows, in your ebook, there is a bio for each of the speakers, which has a lot more information. I'm just going to hit a couple of the high points for each of the speakers. So Dr. Moritz Klemm has been the team leader for animal diseases and international within the Animal Health Unit of the European Commission's Directorate General for Health and Food Safety since 2021. Which is responsible for prevention and control mainly of the European Union Category A diseases and for relations with WOA, the EU FMD and FAO, WOA, GFTADs. Dr. Klemm, the floor is yours.
Thank you very much, and good morning to all. First of all, I'd like to thank the organizers of this meeting, of this important meeting, for giving me the opportunity to talk about the vaccination rules in the EU. And indeed, it's a good time for that because these rules are indeed evolving significantly currently. I will very quickly present the HPAI situation in the EU. We already heard some figures and saw some maps about that. A few words about the animal health law, our new legislative framework for animal health in the EU, and then, of course, the future rules on vaccination that are being developed and are being finalized in these weeks, and then some conclusions at the end. So a quick look at the HPAI situation in the EU. This is a graph taken from the latest overview report available on the EFSA website. It shows the numbers of HPAI virus detections in Europe, so the continent, since 2016. And we can see not only the numbers have increased tremendously, we have every year since 2019, we have a more serious epidemic waves, and the length of these risk periods also keep increasing. And most notably, at the end of, well, there was no real end of the last epidemic season because the outbreak simply continued to occur throughout the summer months and continued also now into autumn, and this was mainly linked to wild birds. Here we have a graph showing the HPAI virus detections in different wild bird categories for the two past epidemic seasons. And again, you can see in the summer month on the right of the graph, in green, the seabirds that were very heavily affected on the shores of several member states. And this again is something new, and the numbers there end in September, and in fact the outbreaks have continued, and so we have this trend for not only an annual epidemic waves, but also something that could become a year-round, let's say, event. And this is a map of the full epidemic season 2021-22 in the EU member states. 25 of the 27 EU member states have been affected. In green, wild birds, those were the highest numbers, more than almost 3,300. It's a bit difficult to read on the slide. In red, we have the outbreaks in poultry, almost 2,400. Incursions mostly from wild life or the high virus load in the environment, and also some clusters with lateral spread in some of the countries. In total, we had almost 50 billion birds culled during that epidemic season, during 1 year. This is more than double of the previous epidemic season. And the economic losses have been huge, in the hundreds of millions, or probably closer to billions of euros lost. And so the risk, in fact, is still continuing and has been year round. I already mentioned that. And whereas, of course, biosecurity, and we've heard that in previous talks, but also surveillance and early detection of HPAI in wild birds continues to be the cornerstones of the prevention measures to protect poultry from HPAI. Of course, a vaccination could become indeed a complementary preventive and control tool to be used indeed in case effective vaccines would become available, and by that I mean really available on the market in the EU. Now let's have a quick look at the animal health law, which is the new Basic Act adopted in 2016 by the European Parliament and the Council. That basically replaced all the previous animal health legislation in the EU. It's now all concentrated in one regulation that has different parts. I'm not going to go into all these details. It is complemented or supplemented by a number of delegated and implementing acts adopted by the European Commission. And the regulation itself only contains the most let's say key elements, and it's organized in different parts. And part 3 is relevant for the topic of this meeting. It's about disease awareness, preparedness, and control, and we have a specific chapter 2, on the use of veterinary medicinal products for disease prevention and control. This is a real, I would say, a paradigm shift when it comes to the use of vaccination in the European Union. In the past, vaccination was prohibited, and there were certain exceptions. Vaccination could be, let's say, authorized by the European Commission, and this is completely changed now. Member states have the opportunity to use vaccination for the most effective prevention and control of animal diseases, including HPAI. So this is mainly described in Article 46 of the Animal Health Law, that provides for this possibility for member states to take measures concerning the use of all veterinary medicinal products to ensure the most efficient prevention and control of all of the listed diseases listed under the Animal Health Law. But of course, there has to be an assessment about the use of these products, and it has to be appropriate and necessary. And then we have in Article 47 an empowerment for the European Commission to adopt delegated acts that would concern what may be considered as such appropriate and necessary measures. And this is what we have been doing for the past couple of years. We have been very busy in preparing such a delegated act that is based on that legal basis, with some prohibitions, some restrictions on the use, some conditions, of course, risk mitigation measures, and also surveillance. And just for completeness, there's also an Article 69 that concerns emergency vaccination. This only concerns the so-called Category A diseases, and that also refers to both of those articles. So this draft delegated act of the European Commission, which, by the way, the draft is available online, so you can have a look at it. It will contain specific rules on the use of veterinary medicinal products for disease prevention and control, including vaccines against the category A diseases. Those are the diseases that usually do not occur and need to be eradicated immediately as soon as they are detected in the Union. And this includes HPAI. And this will set the legal framework to ensure some harmonization, particularly of the surveillance and risk mitigation measures to be implemented in vaccinated establishments, with a view, of course, to continue the safe trade within the Union, but also, of course, eventually exports to other countries. And it's important to note that these rules are fully in line with the WOA standards and recommendations we've just heard about. So this is the proposed approach or the structure of the delegated regulation on the rules for the use of certain VMPs for the control of certain listed diseases. As I said, it's mostly category A and B diseases for both terrestrial and aquatic animals. For the sake of time, I'm not going to go into all of this in great detail. There are some general and horizontal rules, circumstances, conditions described for the assessment by the member states, assessment both on the risk, of course, but also cost benefit. There are some restrictions and even prohibitions for certain diseases like rinderpest. We don't want any vaccination for that. And then we have some annexes with horizontal annexes with the criteria for this assessment, and some details about the official vaccination plan, because vaccination will be part of an official plan and under the control of the veterinary authorities. We have different vaccination strategies that are described, and then of course we also have some disease-specific annexes with conditions on how to do vaccination, what types of vaccines to use, what measures will have to be implemented in terms of surveillance, but also certain movement restrictions. And there's also, of course, recovery of the previous status when we speak about emergency vaccination. And all this will not interfere, of course, with the veterinary medicinal products regulation 2019-6 that deals mainly with the authorization of these products. Now, some important basic principles. So it's what is new indeed is that the member states themselves, they are responsible. They will allow the vaccination. The competent authority decides and controls. As I said, they will have to do an assessment and put forward an official vaccination plan. Vaccination will be part of official measures put in place by the competent authority. There are some exceptions for Newcastle disease, but in essence, these vaccination plans need to be in accordance, of course, with the general rules and measures in the regulation that sets, let's say, a harmonized standard, but leaves enough flexibility for the member states to adapt to local situation. And of course, these disease-specific annexes are very, very important. Now, as I said, there are several vaccination strategies for the prevention and control of category A diseases that also are relevant for poultry. That are described. So this will, of course, depend on the epidemiological situation in the member state. So for disease prevention, if the disease is present, you will turn to emergency vaccination. If the disease is absent, then we have preventive vaccination. In the emergency vaccination, we have in response to an outbreak, we have the suppressive vaccination, which is basically the vaccination to kill a policy in relation to infected and in contact holdings, probably not so relevant for HPAI. to control the further spread of the disease. And we have this protective, emergency protective vaccination that might be more relevant, also in response to outbreaks of the disease, to prevent and control these outbreaks. And there are two scenarios for that. We have, on the one hand, affected member states or zone where there are outbreaks, and to protect at-risk animals. However, of course, not in establishments where the disease has been confirmed or where there's a suspicion. And then the second scenario would be in a non-affected member state or a zone of a member state that is not affected by outbreaks, but where there is an increase in the risk because of outbreaks maybe in the neighborhood. And the preventive vaccination itself will be relevant only for those geographic areas that are not affected by the disease, for preventive purposes other than the ones described for the protective emergency protective vaccination. There are a few special cases for poultry. So preventive vaccination that I just mentioned is in fact going to be available, at least for the time being, only for HPAI. That's the only category A disease where we have a specific part in the annex that is dedicated to preventive vaccination. And a second exception is for Newcastle disease, where basically we will continue to have the possibility for member states to allow vaccination outside of official disease control measures as part of the routine precautionary vaccination that is already known today in the EU. This slide describes the decision-making and implementation process for the use of vaccines. So again, it's the member state very quickly that assesses the situation, decides to start vaccination, prepares, of course, the official vaccination plan. The member state then sends some preliminary information to the other member states and the Commission, actually starts the vaccination, then puts forward the official vaccination plan within certain periods, depending also on the vaccination strategy. It might be more urgent or less urgent. Then the Commission, the role of the Commission is then to review these national measures. There's specific provisions for that in the animal health law. And then the member state, of course, all during the vaccination itself, regularly reports to the other member states and the Commission. And then, of course, implements the disease-specific surveillance, risk mitigation measures, etc. On the state of play, so we have had a number of expert meetings to prepare this delegated regulation, which was finalized in internal consultations within the Commission in July. It was then put forward for a public consultation, public feedback in August, and I included the link in the slide. So this is still available online, so you can have a look. We got a lot of good comments and feedback from various stakeholders that has also resulted in some fine-tuning, some minor changes were made in the text that in parallel has also been sent for translation. We still work with some 20 languages in the EU, so that takes some time, but the translation is being finalized actually this week, today or tomorrow. Then the act will be formally adopted by the Commission probably in early November. Then, since it's a delegated regulation, we have a 2-month scrutiny period for the European Parliament and the Council to possibly object. We hope not. And then it can be published in the official journal of the EU and then enter into force. And that would be probably early January. And also in parallel to the development of this act, we have sent a mandate to EFSA, our European Food Safety Authority, simply because we don't have so much experience in the EU on on the use of vaccination with HPAI. The previous EFSA scientific opinion on HPAI vaccination dates to 2007. So we are in need of some new input. This was sent to EFSA in July, and we have put forward questions related to the vaccines itself, what types of vaccines are available, vaccination strategies, and we expect the delivery of part of the opinion on that by July 23, and then some questions on the surveillance and the risk mitigation measures for which the opinion is to be delivered by March of 24. And obviously, based on this input from EFSA, the Commission will then consider as necessary to fine-tune and adapt these rules in the delegated act. And of course, based on that, also engage or continue to engage in a dialogue with trading partners, also with WOA, of course, with the goal, of course, to further facilitate the safe international trade. Now, some quick conclusions. So the last epidemic season was indeed the worst one we ever saw in the EU. The risk for poultry was continued to be present during the summer month and continues to be present today, which is also something quite new. Biosecurity, but also surveillance remain the cornerstones of prevention of infection of poultry. We have this paradigm shift that I described with the new EU animal health law on vaccination by the member states, and we have an EU legal framework that enables or will enable very soon the vaccination as an additional tool to prevent and control HPAI, which is under development to be finalized soon. And this is in line with the current WOA standards that have just been described. The poultry sector in the EU, of course, is not uniform. We have different characteristics when it comes to the main type of production, the infrastructure, the export orientation. Some member states export more than others that don't export anything. So there cannot be any fit-for-all vaccination strategy across the EU, across all the member states. However, these EU rules leave sufficient flexibility for the member states to decide on the use of vaccination as a preventive or control tool for HPAI, adapted to the national situation and the national and local needs. With this, I would like to thank you for your attention, and also thank my colleagues and my team members, especially Julia Cohen, for the support and their contribution to this presentation, and also for the abstract. Thank you very much.
So the next presentation we have is going to be given. It's about vaccines available and systems for usage in the field by Erica Spackman. Erica sends her regrets that she was not able to come. She is a research microbiologist in my lab in Athens, Georgia. She's been there over 20 years. She does quite a lot of work on avian influenza vaccine, and she serves as our avian influenza subject matter expert to our U.S. National Poultry Improvement Plan, which is the group that's across the U.S. that establishes our surveillance programs, methodologies, timing, et cetera. So she has a lot of work in the surveillance program. So would you please play Erica's presentation?
Hello, everyone. I'd like to thank the organizing committee for giving me the opportunity to present on this topic. However, I'm very sorry that I couldn't be there in person due to a delay in processing my passport and visa. So what I'd like to cover is some background on current vaccine technology. And I realize that some of this will be reviewed for many of you in the audience, but this will ensure that everybody is starting out with an equal background and understanding of what vaccines are available and being used currently for AI in the field. today. So quick disclaimer, this presentation is not endorsing any vaccine type or manufacturer. This is also not an exhaustive review of the topic. Many important references were not listed because there just wasn't room. And I won't be able to cover every possible vaccine situation in full detail. The focus will be on major poultry species, and this is really just a broad overview. Details can be addressed in follow-on conversations. Finally, I'd like to thank Dr. Les Sims and David Swain for providing input on this topic. I'll start with the definition that I'll be using for protection and efficacious as I discuss the different vaccine platforms. Essentially, the goal is to maintain the animal health and minimize production losses. Ideally, there's no mortality or morbidity, but sometimes it's important even just to have a significant reduction in mortality compared to non-vaccinated animals. We'd also like to reduce virus spread and onward transmission. So a metric that's been used in the past is that the vaccine can reduce the shed 100 times or more, or 2 log 10 is another way of thinking about it. Not all vaccine situations are successful at this, but it is a goal. And in some cases where, for instance, ducks aren't sick from the disease, so the animal health isn't paramount, we can help reduce public health risk using vaccination, once again, by reducing the amount of virus in the environment, therefore reducing human exposure. So just a few technical considerations on vaccines. As more background, much of this will focus on inactivated vaccines because these are most widely used in the field. So paramount is that the vaccine has to be good quality. And what does that mean? It has to have an adequate antigenic load to induce immunity. It has to contain an antigen which is closely related to the field strain, and the field strain needs to be monitored for antigenic drift. We're all familiar with the immune evasion that influenza develops, and that vaccines for all species have a lifespan based on this. It's also equally important that the antigen is sufficiently immunogenic. In some cases, a strongly immunogenic protein can overcome antigenic differences to some extent. Because of getting good antigenic matching, historically autogenous vaccines worked well if adequately immunogenic. Effective adjuvants are also really important to ensuring a strong immune response. And the vaccine needs to be able to be administered effectively to birds. Just a few more words on antigen selection and optimization, because this is really important, and we have new technology which has really helped change the game on this. So, most simply matching the antigen. In the past, we've looked at protein alignments of the HA1 protein, antigenic cartography, and just simple HI reactivities can help inform these choices. We want to make sure too that we focus on protective epitopes. OFFLU now is a program to monitor antigenic variants, which should help keep information up to date on what is out in the field. Breadth of response is another goal. And because it's not uncommon for different platforms of vaccines to be updated with different schedules, birds that are vaccinated with a different virus for priming versus the boost, say an HVT prime with a boost with a different inactivated virus, may receive different antigens in those vaccines, and that can help broaden the response. We also now have the ability to custom design our antigens using different computational tools. And that can be used both to help with matching, getting these good epitopes that are protective in the antigen, and improving immunogenicity. Of course, immunogenicity can also be enhanced by good adjuvants. And just real quickly on adjuvants, for inactivated vaccines, they have to be adjuvanted in order to be efficacious. Some other vaccine platforms can also be enhanced with different kinds of adjuvants. I'll mention that of the experimental work and validation work, most of it has been done in chickens, although it seems to apply, at least for the mineral oil adjuvants, across different avian species. And mineral oil-based adjuvants are common. They're commercially available and used for many other poultry vaccines. And this is just a short list. It's by no means exhaustive of different adjuvants that people or different substances people are looking at to use as potential adjuvants in poultry vaccines, not necessarily just for influenza, but for all kinds of different poultry diseases. Another thing that's important, once again, getting back to inactivated vaccines, is the actual method of inactivation. So cost and safety are really critical, and we need to preserve epitopes. Chemical inactivation using formalin or BEI are quite common. However, they can change the conformation of the protein and introduce modifications. So there's some interesting work using irradiation as a method to inactivate the virus that's come out of Dr. Giovanni Cottoli's laboratory. So that's an interesting new technology that looks promising. And then finally, doesn't matter how good your vaccine is if it's not available. So vaccine production is something we can do. Other speakers will give much more detail on this. We can get sufficient supplies of suitable vaccine within the time frame we need to apply it is really what's critical. And there's lots of factors here. Stockpiles and vaccine banks have been used in the past. One issue with influenza is how do you choose an antigen for a future outbreak? Because you can make a vaccine and then a different subtype or a different sublineage comes in and your vaccine doesn't help. And right now, I think most people would bet on clade 2344 as an antigen, and that seems probably like a sublineage we're all going to be dealing with for a while. But that is a consideration. There's production considerations as well as regulatory issues, and other people are going to address those. So let's talk about the vaccine types. I'm not going to cover live vaccines because Dr. Ian Brown will talk about those. Just a few things on experimental vaccine platforms. And once again, not an exhaustive list. There's a lot of things out there, just a few examples pulled out of the literature. Because influenza is such an important agent for humans and animals, it's a proof of concept agent for vaccines and diagnostic tests and all kinds of any kind of viral technology, it seems. Although most of the vaccines and the technology are developed for human use, some of them may be applicable to the veterinary side. And once again, just a list of different things that people have used as either vectors or different ways to introduce vaccines for AI. They're very much in the exploratory stage, so it's hard to tell always what will be useful in the field. And sometimes things perform really well as a vaccine, but the production issues prevent it from being actually practical for field application for poultry. I already talked a little bit about inactivated vaccines, and these are chemically inactivated whole virus oil adjuvanted vaccines. And based on a paper by David Swain from 2011, they comprise by dose about 95% of all vaccines that are used for poultry for avian influenza. They are known to be efficacious in many species. Most of the data has been produced with chickens and turkeys, but there are data with Pekin ducks, domestic geese, and domestic waterfowl that indicate broad efficacy. And although it's out of the scope of this workshop, There has been talk that these could be used with zoo birds or endangered species in addition to poultry because of their potential broad host range and safety because it's an inactivated antigen. However, there is data lacking on some of these specific species. Importantly, inactivated vaccines really only induce humoral immunity. There's not enough of a cellular response, if any, to add to the immunity in that standpoint. It requires strains that can replicate to high titers in eggs. So that's a production issue, as well as a virus with low pathogenic cleavage site, which helps for safety. Both of these can be overcome with reverse genetics these days. Inactivated vaccines are relatively expensive to administer in some areas where labor costs are high because of the need to inject individual birds. In some countries, there is a regulatory withdrawal time for meat birds. So in some places, using these in, say, broiler chickens, which are short-lived, wouldn't be practical. I'll also mention that there are inactivated vectors using avian paramyxovirus type 1. So this is a bivalent AI-ND vaccine that also uses an inactivated platform. Vectored vaccines induce cellular immunity in addition to humoral immunity. And this is important because it can help broaden the response and makes these vaccines more robust to antigenic changes and antigenic divergence than inactivated vaccines. Licensing of specific vectors does vary by country, so availability can be regional. Vectored vaccines can also be adversely affected by prior exposure of the host to the vector itself, or if they have maternally derived antibody to the vector or the AI insert. So that's another consideration when using vectored vaccines. What other vaccines are being used, what other agents the bird is being exposed to in the field. Some vectors are species specific, so that can limit broad application depending on the specific vector. A good advantage of vector vaccines is the proteins are not altered by the chemical inactivation process, so they're in their native form and are going to induce antibody to the correct epitopes. Vectored vaccines mostly use egg-free production, which can be helpful logistically, and avoid mutations due to passage of the virus in eggs. As subunit vaccines, vectored vaccines allow for easy antigen updates, although that process can be affected by regulations. And it can also help with DIVA strategies, depending on the DIVA strategy being used. And other speakers are going to cover DIVA strategies in detail. List of some of the more common vectors and subunit vaccines out there. We have several replicating vectors, which include herpes virus of turkeys, foulpox virus, avian paramyxovirus type 1, and several non-replicating vectors, which are generally virus-like particle based, and the nucleic acid vectors. And I'll be speaking about each of these in a little bit of detail. So HVT is a stable, well-characterized vector. As mentioned before, it induces good cellular immunity and can tolerate antigenic variation better than inactivated vaccines. Immunity is not fully inhibited by maternal antibodies to the AI insert, which is also a big advantage. It can be mass applied when administered in ovo in the hatchery. And immunity can be enhanced when used as a priming vaccination when it's being used in birds that are longer lived and may need a longer duration of immunity. It's been shown to be efficacious for both chickens and turkey. HPT has also been investigated for its efficaciousness in different domestic waterfowl. It doesn't replicate very well in pekin ducks, so does not provide good protection. However, Muscovy ducks and mule ducks and domestic geese do get some protection. The vector does replicate in these species, not quite as well as it does in chickens or turkeys, but may be viable when used with a boost or in specific vaccine regimen. So for waterfowl, one option is to use a vector such as duck enteritis virus, which is another herpes virus that causes an important disease in domestic ducks. So it's already being controlled by vaccination. Because disease from HPAI can vary by strain, duck age, duck species, it's not always a priority to vaccinate the ducks to prevent disease. So sometimes vaccinating ducks may be more to prevent virus spread and contact for other species by reducing the amount of virus in the environment. And a DEV vector would be one option for that. And it has been shown to be efficacious in domestic ducks. And one study also looked at this vector in chickens, where it did also reduce mortality and virus shed. Foulpox virus is another well-established vector. It's administered either by sub-Q injection or very commonly by wing web stab, as you can see in the photo, where a apparatus with two different needles that have channels in them are dipped into the vaccine. The vaccine is taken into the needles by capillary action, and then it's stabbed through the web, which exposes the live virus to the epithelial cells. It is not fully inhibited by maternal antibody, but it does have a fairly limited host range. At least the strains of Foulpox virus that are being used, they really work the best in chickens. However, there is some data that they could work in Pekin and Muscovy ducks if used with some kind of a booster shot. So it's been suggested that this is best used as a live prime vaccine in chicks. APMV1 vectors have been around for a little while too, and have been used in the field primarily in Mexico and China. One of the advantages of this vector is because it replicates in the local mucosa in the same areas where influenza is going to infect, that induces the right kind of cellular immunity and mucosal immunity in those areas. So it's, one way of putting it is it's really relevant immunity, as well as a good antibody response can be induced. It can be mass applied in by spray or in drinking water, similar to other poultry vaccines for respiratory viruses. Most of the data for APMV1 vectored vaccines are from chickens and turkeys, but they may be able to protect other avian species because APMV1 has a very wide host range. So it would be expected that it would replicate reasonably well in most birds. However, it has been shown that interference from APMV1 maternal antibody or prior exposure to live Newcastle vaccines can limit application. And because that's so universal, vaccination for Newcastle, that's a really important consideration. So once again, a possibility for this is that it could be used well as a live prime after maternal antibody wane or in naive chicks. Alpha virus like particles are a newer vaccine technology, and this is a non-replicating vector. So it's a virus-like particle where the alpha virus and your antigen of interest are packaged without the viral packaging machinery, so it can't complete a round of replication. In this case, multiple doses of the vector can be used. It doesn't interfere with itself like some of the other vectors, which like the APMV1, which can't be repeatedly applied. However, data are a lot more limited because this is a newer vaccine. But so far, there have been numerous studies that show that it's effective in chickens, turkeys, and Pekin ducks. And this was licensed in the US after our outbreak in 2015. Baculovirus vaccines are another well-known vector system. Once again, it provides native antigen presentation with conformation and native post-translational modifications. They're very immunostimulatory. Some people have said even that they kind of self-adjuvant. Multiple doses can be used similar to the alpha virus VLPs. So baculovirus vaccines have been developed both as virus-like particles, and there are cases where they have been used in purified proteins. There is a quadrivalent vaccine that was developed for seasonal influenza, and the purified protein format is probably not as practical for poultry because it requires a lot more processing, and that may not be necessary for the best immunity, but it is out there. Bivalent vaccines for both low-path AI and high-path AI have been shown to be immunogenic in chickens using the VLP form. And I'll also mention, because this is interesting, and if there was a way to apply this to poultry, it could be quite helpful. Both intranasal and oral administration has been protective against influenza A in mice. So once again, being able to have a broader administration method, so mass administration method and development of mucosal antibodies, if something can do that, that definitely would help the vaccine. Self-amplifying RNA is the current generation at the top of the list, so to speak, for the nucleic acid vaccines. I'm not going to mention too much about DNA or some of the other mRNA vaccines because the saRNA platform seems to be so much better in a lot of ways. And of course, with the success of the mRNA COVID-19 vaccines, it generated a lot of excitement for nucleic acid vaccines, and people right away started looking at how to apply these to poultry. And they're not just being tested for AI, they're being tested for numerous different poultry diseases. And what they are is, it's basically a viral replicase that's driving the amplification of the RNA and then translation of the antigen in the host cell. There are different viruses that are used as the template for this. Alpha virus is one of the more common. It's usually just a non-segmented positive sense single-stranded RNA, although you can use negative sense viruses for this as well. So one of the great advantages of this compared to the other nucleic acid vaccine formats is that you can use a much lower dose versus the other platforms. So one study showed that the saRNA was effective at 1/64th of the dose used versus traditional mRNA vaccines in mice challenged with influenza. So that's a really important practical thought. They're easily updated as well, like any of the mRNA vaccines, and they can be encapsulated for better stability. So there are still some issues that need to be perfected that can make the transportation and storage of these as robust as some of the other vaccine platforms. And finally, I'll kind of wrap it up here, mentioning some of the vaccine platforms that are being tested. And this list of different platforms is courtesy of Francesco Bonfante. So I appreciate him sharing this. And just showing a lot of the kind of newer and older vaccines, HVT, Newcastle AI, inactivated, the SA, RNA, DNA-based vaccines, and then some baculovirus subunit vaccines. We have a similar slate of vaccines in the US. HVT and inactivated vaccines are still oldies but goodies, so they're high up on the list, but certainly some of the experimental platforms are always in play as well. So with that, I will wrap. Appreciate your attention, and once again, I'm very sorry that I could not attend in person.
Okay, next on our agenda is Carol Dumarche, who is the Executive Director for Health for Animals, which is the Global Animal Health Association, which includes the top 10 global animal health companies that develop and manufacture veterinary pharmaceuticals, vaccines, pesticides, diagnostics, etc. It's actually the association contains 29 national animal health associations that it represents, total of 85% of the global animal health sector. So it has a wide, broad spectrum impact across the globe. So his presentation will be biological industry challenges to developing, registering, including updating strains and making vaccines available for high-path AI control.
Thank you very much. Thank you, Dr. Swain, and thanks to IABS. This one, right? Thank you to IABS, the sponsors and the participants for being here. So as the introduction said, Health for Animals represents 85% of the global animal health industry. And you see the logos of the 10 corporate members up there. And we also have associations in 28, 29 countries. We work, we figure that our industry is present in about 100, 150, 40 countries around the world where our products are sold. And well, you said what's on the slide, so I'm not going to repeat it. You asked me to be on time, so I'll be on time. What I do want to say is in this room and online, there are about 20 plus representatives. I looked at the participant list, 20 plus representatives from our industry, which gives an indication of the interest in this. 5 of the companies up there are in the room or online. Once again, we're very keenly following this, and I'll give a few examples of what we're doing throughout the presentation. But this one's a little bit different from the previous presentations because I'm going to make a much more political plea in this presentation rather than a technical one. So we've heard a lot about the scale and scope of HPAI and its impact. And if we look to the future, let's be honest, it's not going to get any better, is it? The current route, the current routes, the current predictions are pretty dire and going to get worse. So I think that's the starting point for what I'm going to say today. So what needs to be done? So I've basically tried to put on one slide, and I'll talk about each one separately a little bit after, but what needs to be done? On the scientific side, I think we need to increase our understanding and assessment of current and predicted spread. All of the spread predictions have been or many of them have underestimated. It's going to continue to spread. And it says, you know, which agencies and entities should be and are responsible for that. Many of them in the room. Let me jump to the second point. What else needs to be done to address hurdles or barriers on the policy and trade side? And this is maybe the most important point I'll come back to a couple of times is we need to have political decisions on whether we continue to cull alone or whether we combine our strategies with vaccination strategies, all of course done within WOA standards. And who's responsible for that? Well, the predominant responsibility for that lies with governments. And again, I'll come back to that point. But that is the most important point. If you forget everything else I say, that's the most important point that we would like to make, is we need political leadership here. Societally, the point's been made, continued social acceptance of mass culling is questionable. And we also, a number of speakers spoke about the biodiversity issues, and there's not a potential, and as well as, retail and consumer views, all aspects which are part of it. But I would say that culling, I don't know what Madame Eloi said this morning. I think I heard 400 million birds. I've heard different numbers, but that's a lot of birds. And what the societal acceptance of that is, I don't know, but I would think that it's going to be decreasing over time. And then technically, and that's where I'll delve into in the next slide, is getting new vaccines, and importantly, new types of vaccines to market, which allow easier preventative or emergency vaccination. And I think that's, maybe it's because it's the last few words in the slide, you could easily skip over it. Preventative or it should say emergency vaccination. I think we need to look at it like that. So what are we doing? There is significant investment in the companies right now in new AI vaccination solutions. As I said, we have a number of companies that I represent. There are other companies, there are private public sector entities, there are academics. There's a lot of research going on. But multiple of the companies that the logos of which you saw are actively working on this. We believe they have to be DIVA vaccines. And clearly there's a lot of answers, a lot of questions that still remain to be answered. Dr. Spackman and others are giving kind of an overview of what's available and what the technologies are. I won't go there. I believe you're going to talk about that as well. So again, probably better informed than I am on that. But the most important is that we start having these discussions that we're having today. And it is important that we as an industry, and that's why we're here, and are engaging in these types of fora, because there's one message again from us, that we are working on the technical solutions. They will be there, but we need movement in other areas. And so maybe that's to that slide where we need movement. When any vaccination company is not just a vaccination company. There are very few which only do vaccination. Every company has internal fights about where to invest their euros, dollars, yen, etc. And sometimes those fights are literally between a product for the pet market or an AI vaccination. And these are our return on interest discussions within companies. And the fundamental part of that discussion is how big is the market going to be, and how predictable is it going to be? Size and predictability. And in both cases right now on AI vaccinations, it's very unpredictable. So once again, clear policy guidance, political leadership, of course, with market demand, is essential for our industry to make the decisions we need to make in order to continue to invest the large amounts which are being invested right now. And then I said I'd stay on time, Mr. Chair. So turning to my last slide, things take time. So much so that in the first bullet, it takes twice as much amount of time. It takes time to move to authorization. It takes time to get our products ready. It takes time to get the authorizations. It takes time to get those huge volumes of supplies that are needed. Obviously to vaccinate, but also to distribute. Don't forget that. We need surveillance tools for DIVA vaccination, and that requires the involvement of diagnostics manufacturers. We represent them as well, some of them, most of them, many of them. So they need to be involved in this discussion. And then, the question is, are the surveillance systems ready for this? And are we preparing for a scenario, it's later on in the agenda, for a vaccination rollout? Once again, I'm going to leave you with 3 points. What's the tipping point for vaccination? How many birds need to die before we get there? I don't know the answer to that. And that's part of all of those considerations. What type of political leadership do we need? And I'm going to posit the first idea today, or maybe it's not the first one, but one of the first ideas today of what we need is we need a permanent political mechanism for discussion between governments involving IGOs, poultry and egg industry, vaccine producers, and trade and legal experts and so on. We need a permanent mechanism for discussion on this and how we're going to resolve this as a global issue. And I'll leave it at that, Mr. Chair.
Thank you very much. Okay, we'll proceed on to our next section is surveillance for high-path AI virus in vaccinated populations. The first presentation on the subject is developing appropriate surveillance systems that provide confidence that high-path AI virus is not circulating in poultry. This presentation will be given by Dr. Tim Harder. Dr. Harder is a virologist with a veterinary background and broad interest in influenza viruses. He is a researcher and head of the National Avian Influenza Reference Lab at the Friedrich Lüfer Institute on Isle of Reims in Germany. He has led laboratory activities and has been an active member in our international networks of WOA, OFLU, FAO, and others. Dr. Harder.
Yeah, thank you, Mr. Chairman. Yeah, ladies and gentlemen, very few of you will find this kind of slot on your keyboard of the computers, make everything okay. So, and it is no help to talk to your IT department either in this respect. So we have to resort to something different if we want to control vaccinated poultry flocks. And this is the first, trust is good. What kind of trust is required? And we just have heard a minute ago that matching safe and immunogenic vaccines are selected to the needs. They are fit for purpose. And that is, of course, the duty of the research departments and the licensing authorities and so on. The next point actually touches on surveillance. Vaccine application ensures that a sufficient coverage is supplied to the different flocks and reaches each animal. That in turn would produce an adequate population immunity that also needs to maintain over several weeks or months or even years, depending on the type of poultry. And we will be talking more about trade later in this meeting, but trading partners as well as we, the consumers, should reward these added efforts of the poultry owners, because they have to invest a lot of money and probably using the vaccine, extra vaccine, and also paying for the surveillance, if that is intended, will add to the price of their products. And trust, finally, is only built if we really can exclude circulation of the high-path avian influenza viruses from those vaccinated flocks, and thereby ensure that the products of these flocks and the live poultry traded from these flocks is safe. Now, trust is good, but as we all know, control is better. And for sure, we're doing surveillance to enforce vaccination control, and there are several strategies and diagnostics that need to be adapted to the actual epidemiological situation. It will differ widely if you have endemic circulation of high-path AI. If it's epidemic, as it is now, more or less in Europe and North America, or if it is sporadic, as it has been in Europe a couple of years ago. We already touched upon the capacities of public veterinary services. We need to take into aspect the socio-cultural environments. Is there live bird trading? Is there a slaughterhouse management and so on? And finally, the scope and the aims that vaccination should have if we implement it. So it can be local, regional, national. It can touch just on sectors of the poultry population in the country, simple integrations, and so on and so forth. And I think Dr. Sims already mentioned that today it can be costly. It can be really financially demanding depending on what kind of aim we want to achieve. So just briefly touching on that, what you all know, there are different approaches to surveillance. The passive one is what we usually use when surveying wild bird populations. If we do that for poultry populations, of course, that relies on those at the immediate fronts. That's the farmer, his vet, traders, and so on. They report suspicions, and they do it more or less good. So the quality of passive surveillance will vary between farms. And since this is one of the goals of vaccination, to minimize clinical signs and cut down mortality, it will be naturally intrinsically less effective in vaccinated populations. On the other hand, active surveillance, in active surveillance, you usually have a very neat surveillance program that regulates inspection, sampling, and testing methods and frequencies. The sampling frame, which kind of farms, the number you involve, the sample frequency, and the tests you apply, all that defines the precision of your surveillance. For example, if you want to exclude that more than 1% of your flocks, of your vaccinated flocks, are infected with 95% confidence, the available tools on the internet, EpiTool or whatever you are using tells you that you need to investigate 299 farms for that. If all of these farms test negative, well, that will tell you with 95% confidence that your incidence of infection, if you are going for PCR tests, is less than 1%, but there is 5% chance that it is higher than 1%. Yeah. So you never have 100. You can try to achieve 100%. That would mean testing all farms and all animals on the farms, which is impossible. As Dr. Swain already mentioned in the introduction, there will be papers for the different keynotes, and also this keynote will have a review paper, and many of my co-authors for this paper are in the room. Thank you for your time and brains invested in that, and there will be more details presented on those questions in the paper. Active surveillance, due to costs, cannot be continuous, and it is often advisable to have a, well, I call that pre-testing signal enhancement rather than have a random scheme of sampling. And this kind of bucket sampling, so a collection of all fallen animals within a week or so that are tested by the end of the week by a sensitive test like real-time PCR, that really limits the number of samples that you need to test, and also limits costs. And I think many of the poultry integrations in Europe and in North America, at least I know from my country, are already practicing this kind of signal enhancement for their internal testing. So one of the most important things then for surveillance is to monitor vaccine coverage and population immunity. Vaccination governance is important, just meaning registration of holdings, vaccine time points, type of vaccines applied, and so on, and to control vaccination distribution and uptake. A second thing is actually the assessment of vaccine-induced protection, and here comes into play the antigenic match between the vaccine virus and the circulating field virus. If you really want to know how good your flock is protected against the actually circulating virus, you need to do all these tests with that virus. It's also advisable to define a number of thresholds. What is your surrogate of protection? Are you doing HI assays? Are you doing neutralization assays? And what do you accept as a threshold of protection? There's a lot of debate about these kind of thresholds. And as I learned from my colleagues from Hong Kong, Dr. Ho, or from Indonesia, Dr. Prajitno, you need some experience actually in getting a feeling for what is acceptable and what is not. So there is no textbook threshold that you can use, I guess. Vaccine type and poultry species can have an influence, of course, and ultimately vaccination challenge trials may be required to really find these thresholds for the combination of the vaccine you are using, the type of poultry, and the kind of circulating virus. And that is, of course, the field of central institutions like FLI, like mine. Second, of course, this is the main goal actually of surveillance. You prove the absence of high path circulation in vaccinated flocks. You need to have a system in place that will help you detect new outbreaks in those flocks. And the goal, of course, is to avoid any spread of virus from those flocks. So the spreading factor R0 should always be well below 1, so that no vaccinated flock that eventually becomes infected starts a new outbreak. As I mentioned, passive surveillance is tricky in those vaccinated flocks, especially if we talk about waterfowl. I learned also this time from the Hong Kong experience that the Sentinel strategy as one control item is becoming less fashionable due to several reasons. Maybe Dr. Ho has an opportunity to explain that in more detail during the discussions. I already mentioned that targeted rather than random sampling is what you should try to establish. And along with this targeted sampling, the environmental samples that also have been mentioned today by Les Sims are coming more and more, I think, into focus. Zero surveys are compromised, of course, by the type of vaccine you use. Is this a marker vaccine or not? And do you have interfering low-path avian influenza infections like H9N2 in many regions? And again, I already mentioned the precision of surveillance depends on your defined thresholds. This is something you have to define yourself for your country, for the epidemiological situation, for the type of holding and the type of vaccine. And now the psychologists come into play. This group, this American group, mentioned in the mid-1970s that control is an illusion. What does that mean? So this is just Wikipedia level of psychology, don't worry. So just two examples. When rolling dice in a craps game, people tend to throw harder when they need high numbers and softer for low numbers. Yeah, you all did it, I know, yourself. And translating that into the field of AI vaccination, many people think still more frequent boostering or actually do it in the field helps to push protective levels of immunity. I think that's not true, at least not entirely true. And we know, and also from Erika Speckman's talk, that there are many factors that influence the induction of protective immunity. And then I like this very much, the irrational primacy effect. That is involved when people give greater weight to information that occurs earlier in the series. If we think about a series of vaccination experiences, and Les has already mentioned that as some of the taboo reasons why vaccination is looked at as something, should we do it or not? the previous examples and the interpretation of the results. And we all know, and that has been shown already, that the beneficial effects can be corrupted by many more aspects, and we need to control all these aspects. So we've seen these figures already today, so I can be very brief, just mentioning that they have been assembled by a group in the European Food Safety Agency, headed by Francesca Baldinelli, who is also in the room today. And thank you, Francesca, for providing these quarterly updates with your group. It's really wonderful to have these data, and these show us that the epidemiology, this is the European view between wild birds and poultry, is linked. This is very common grounds, but actually you can see that nicely in these figures, and that there were sporadic wild bird cases during the summer of 2021, and they have increased massively during this summer, causing all the problems David Swain has mentioned already. These are just examples from the European North Sea coasts, with the mass mortalities in colony breeding seabirds. We also saw that the epidemic in Europe in wild birds during 2021 has given rise to a spread of that virus into North America, probably via Iceland and other islands in the North Atlantic, and then caused the well-known wave of outbreaks in the US. And probably this kind of incursion pressure will continue. And on the other hand, we have endemic infections in poultry populations in many countries in the world, and the risks that we have ongoing spillovers by many different mechanisms, the rice paddy ducks, the dumping sites, and even in more or less intentionally, when you see these chicken dropping fertilizers for fish farming in the tropics. And of course, this is what I like, the worst case scenario, the illegally transported and imported poultry meat and products, you know. In Frankfurt Main, in Germany, our main airport, at least, it was over a period of 3 months, a couple of years ago, more intense searching, and they ended up with tons of raw meat in the passengers' bags. Of course, new incursions, we know how fragile the borders between the wild bird and the poultry habitats are. So as a third goal of surveillance, we need to assess the circulation in unvaccinated sectors. We need to follow the trends of infection in these populations. We need to do our best actually to see where the virus is going and how the virus is changing. So it's also very important to keep track on the antigenicity, for example, of the viruses to inform vaccine production. And that also includes, of course, the wild bird populations in the area. And then also we have to think a little bit ahead, out of the box, across the horizon, and think what can we do about the wild bird epidemic. They are suffering, and some of the endangered species actually are at the brink of extinction, and probably HPAI does no good to them. And we know with northern gannets, Bass Rock in Scotland is one of the main breeding colonies of that species, being deserted over this year, and losses in other breeding colonies were as high as 40%. So is there anything we can do for these birds at the moment? Probably not, but we should think also, we should include into our thoughts this field. Vaccinated wild birds may help to lower the virus load in the environment, for example. And we have good examples, especially in Europe, with rabies vaccination in red foxes and classical swine fever, eradication from wild boar populations here in Europe. So this is just one concluding slide. Full control, I think, is an illusion. That's true, but we should do as much as we can to control vaccination in poultry as much as is required, actually. We know that other obstacles have been overcome in the past, and I included this photo and example because the site where this Otto Lilienthal did one of his first gliding flights was not too far away from the site of my institute. And most of us here in the audience came to Paris by air transport. So we all accepted a certain level of risk. We know that planes come down eventually, but we also had a lot of trust in the surveillance of the planes, the education of the pilots, and so on and so forth. And it is our duty, I think, to produce, to build that kind of trust also when vaccinating poultry population against high-path avian influenza. Thank you.
Thank you for the presentation. Now we'll proceed to the second talk in surveillance. What do we have in commercially available toolbox now? And what are the advantages and disadvantages of existing systems? That's going to be given by Jacques de Witt. Jacques is a senior researcher at the Royal GD and professor of integrated poultry health at the Faculty of Veterinary Medicine of the Utrecht University. And he had extensive involvement in the 2003 H7N7 high-path outbreak in the Netherlands. And currently he's boots on the ground with the current outbreak in poultry.
Thank you very much. It's don't worry, it's a relatively short talk. It's about a commercial available toolbox. So you might have in-house techniques, but maybe you might need some more, or you're not able to use in-house techniques. I guess we all know this schedule from the terrestrial manual, which gives a kind of overview, which kind of test you might use for which situation, but this is not specified for vaccinated flocks. And when we are talking about in diagnostics for avian influenza, we have to consider, well, basically, what's your question? Are we talking about, well, showing freedom of infection, or do we want to detect an infection? Do we want to take the check of the do we want to check the take of the vaccine, or well, to see what level of protection, as Tim was mentioning, can we expect from this vaccination program? And maybe, well, it might be epidemiology. Well, different goals might require different tests. We also have other factors. Are we talking about chicken, ducks, geese, turkeys? Then you might need another test. Are we talking about vaccinated or non-vaccinated flocks? And then do we use a whole inactivated antigen or maybe a DIVA approach? Are we talking about endemic situation or just an acute situation? And maybe we do not talk only about maybe detecting H5 infections, but you also have maybe H9 and 2 in the flocks, and that might interfere with diagnostics. So, and in the end, whatever test is going to be used, it always should be validated as fit for purpose. Validation simply in the lab with a few control samples is not a validation as fit for purpose. That's just theory. You have to show it on real samples. Well, a few slides about diagnostics in general, and then focused on avian influenza. So the first one is about the detection of the virus itself. Well, two main techniques are available commercially. The antigen capture immunoassays, let's say the point of care test. And they are available, but they have mostly been developed for human strains, for human influenza. So they are not, well, they have a varying sensitivity for our samples, which is usually, it's not very good. It's 3-4 logs lower in detection limit. So they can be used, but it's mostly recommended for acute cases with sick birds that, you know, okay, if that will be a high amount of virus, then they can be suitable. Not on bird level, but on flock level. PCR or RT-PCR, as you know, it's well, much more sensitive. Different PCRs are available commercially. We have the ones that are use a conserved gene, usually the M gene. There are also subtype specific H5 PCRs available, and there are also some N subtypes. Well, again, these PCRs should also be validated as fit for purpose, so not just a few control samples for your validation process. But on average, the RT-PCR and the sensitivity can be excellent, and maybe even so high that we can, in the end, start discussing what does a CT of 39 mean. That's most likely not an infection anymore. It was maybe something from the past. So the flock itself might not be infectious anymore. Even with PCR, the H5, or let's say influenza, is so variable that even the conserved genes can mutate. So there has to be a consistent monitoring for primers and probes that they are still fit for the virus that you have in your area. Big advantage of the PCR you can use basically for any species. If you now focus a few slides on antibody detection, agar-gel immune diffusion test is most likely not a test with the best image, but that doesn't say it cannot be useful. It's influenza A specific, so it doesn't say which subtype might be involved. It's focusing on precipitating antibodies, which works quite well with turkeys and chickens, but not very well for ducks and geese and other species. So, and we know sensitivity is quite good, but especially in the acute phase, the first weeks of infection, you can expect very high levels of positives, but a few months later, the number of positives can be really down quite a lot. A test that will be used more and is promoted more is the hemagglutination inhibition test, subtype specific. So, well, it's for H5 or H7, etc. It can be used for all species or samples from all species. However, if you use chicken red blood cells for this test and you use non-chicken sera, you might need to absorb the sera in advance to get rid of non-specific reactions. Another complication of the hemagglutination test are the potential antibodies against the neuraminidase. For example, if you have antibodies against, well, let's say you have an H9N2 infection in your flock, so you have N2 antibodies. If you then use an H5N2 antigen, you might have some HI antibodies detected against H5, not against the H5, but against the N2. But so it can be confusing. You can have some non-specific reactions. Well, this can be avoided by using two different antigens per subtype. So maybe H5N3, H5N2. And if then both antigens are positive, it are antibodies against H5. It's only against one of two, it are the antibodies against neuraminidase. Well, that's an option. Another option, if you have a country with, for example, H9N2, don't use an H5N2 antigen. Use another one. That's more homologous to your field strain. Yeah. As far as I know, there are not yet H antigens without, if you have, in the future, there might be more antigens available in which these, well, steric hindrance by this neuraminidase antibodies are gone. But as far as I know, they are not yet on the market. A big advantage of the HI test is if you use the right antigen, you have a strong correlation between the level of antibodies that you find and the level of protection that you can expect against your challenge. Well, then a few lines about ELISA. A lot of ELISAs are available. Part of them use a whole virus, complete antigen. Part of them use a recombinant antigen like the nucleoprotein, or, for example, H5 antigen. So they can be, let's say, influenza A general. They can be subtype specific, or, for example, only against nucleoprotein. It is important to realize what kind of ELISA it is. If you use an indirect ELISA, and they are appreciated because they give nice titers, very often they use a chicken antigen or turkey antigen, And that means that don't expect to detect antibodies from a duck or a goose or whatever. Then you need a dedicated new other conjugate. In general, ELISA titers do not have a good correlation between level of antibodies and protection, because they don't measure the, let's say, the protective antibodies, but antibodies in general. So if you then look for the current H5 vaccines and the different DIVA options, there are different kind of vaccines, different kind of tests, different kind of field situations. So basically, the big question is, can you find a match between what you need and what's available? Well, then there's this slide, and I apologize that, here it's a bit better to read it than over there. There are different situations and there are different tests. If you look on the, let's say the left column, you see the different field situations. On the, let's say the highest row, you find the Acogel immune deficient test, HI test for H5, 3 forms of ELISA, whole antigen, nuclear protein antigen or H5. And then you find an antigen, let's say the point of care test, and you have the PCR. PCR for, let's say, a conserved gene, M protein, for example, or H5. Well, if you then go for the first situation, if you have no influenza in your flocks, no vaccination, and no other endemic virus, like maybe H9N2, so basically you expect not to find anything. Well, basically in any, whatever test you would like to use, there are a lot of options to check that your flocks are free of influenza. If you go to the next situation, you do not vaccinate for H5, but there is another subtype in your flocks, H9N2, H6N1, whatever. And then the number of options goes down. The H5 test is still very suitable. H5 ELISA would be suitable, but the other test will become positive. And you can go for the antigen and PCRs. And so still quite a lot of options. If you do vaccinate for influenza H5, so let's say you do vaccinate for H5 using a complete virus antigen, basically the serology stops unless you use sentinels, but the vaccinated birds cannot be checked anymore. But again, the virus detection is still very suitable for detecting, well, showing the presence or absence of the virus. If you use a H5 DIVA vaccine and there are no other influenza strains in your flocks, and then, well, the agent might not be able to detect the response to the vaccination, but NP ELISA will very well be able to detect the infection or show the absence, and you still have the virological methods. If you have a combination of DIVA vaccination and another subtype in your flocks, yeah, then serology is, let's say, not going to be very useful anymore. Then I guess you have to focus on the virus detection. If you would like to check the take of the vaccine, so does the bird respond well to the vaccine I have applied? Serology is a suitable method. That can be by HI testing, that can be done by ELISA. If you want to estimate the level of protection against the field strain that's involved, HI testing is best, but then your antigen has to be quite homologous to the field strain that you have to deal with. So, take home message, there are a lot of different situations, but for any situation, DIVA testing using commercial available tests is possible. So this barrier is not needed. There are solutions. But however, depending on the situations, you might have less options than in another country, but there are always solutions. And with that, thank you for your attention.
Thank you, Dr. DeWitt. Our last presentation before we have our lunch break is public health considerations of avian vaccination. It's going to be given by Dr. Richard Webby. Dr. Webby is a member of the Department of Infectious Diseases at St. Jude's Children's Research Hospital. He has had a great deal of involvement with influenza, both in wild bird ecology and as well as human influenza. He is the director of the World Health Organization Collaborating Center for Studies of the Ecology of Influenza. In his role, he's contributed to influenza pandemic preparedness and has actually chaired the vaccine composition meeting, including the assessing virus risk and developing candidate vaccines for those of most concern. Dr. Whitney.
Thanks, David, and welcome all. So, this topic I think is actually pretty simple, and I think Liz and Erica have both commented on it that if we can reduce the amount of virus that's in birds, we reduce the amount of virus in the environment, we reduce the chance of a human coming into contact with that virus, and we reduce the public health risk. So now I could probably stop there, but much to David's disappointment, who's trying to get us on time here, I'm not. But I'll try to go this relatively quickly and try and just to put into a little bit of context, how WHO is monitoring these, assessing risk of different viruses and how, vaccination may play into those. So this is essentially taken from Les's bubble diagram at the start, and he was kind enough to share that, and looking in terms of public health, how many of those bubbles on there really could have some public health impact. I just want to put this into two categories here. And one is drive the spread, although I think most of agree that's actually not likely, and it's more likely going to be the other way, that successful vaccination will reduce spread. But even so, how either of those sort of feed into the public health risk assessment of zoonotic influenza viruses, and the other in terms of the potential for vaccination to drive antigenic evolution, or if not necessarily drive it, maybe just slightly put different pressures on it than otherwise would be there. So I'm going to firstly go through and look at this, the first point here, how does the spread or the amount of influenza in an environment impact public health risk? And so what I'm going to use to illustrate that is this tool. This is the tool for influenza pandemic risk assessment, is TIPRA. It's a tool that the World Health Organization uses to assign relative risk to influenza viruses circling at the human-animal interface. And the output of this particular risk assessment algorithm is something like this, where a virus X is put into relative space here. Along one axis, the likelihood that that virus will emerge in the human population. On the other axis, the impact. So should that virus emerge, what likely impact? And as you can sort of imagine here, as we fill this out with different viruses, you get a relative risk of the different viruses for public health. It's not an absolute value. It's more to prioritize the relatively limited preparedness resources that are out there, and make sure that they're targeted towards the most relevant viruses. And again, without going to any detail here at all, there are a number of elements. So the way it works is there are a number of expert-defined elements that are considered to be important for assessing public health risk for circulating influenza viruses. And they range from public health factors to animal health factors and virology. And there are two on here that are directly impacted by the amount of influenza viruses circulating in avian reservoirs. And some that are indirectly as well. And they're highlighted there sort of in the red box. So infection in animals and the geographic distribution in animals are two elements that are actually scored in the assessment of viruses for public health risk. And so just to give you a little bit more of the blurb on what exactly they are. So these are actually words from the guidance document for TIPRA. And so the geographic distribution, when experts assign a score to a given virus, they're actually asked to consider the potential exposure of infected animals to humans. And, if I think, as we all expect, a successful vaccination program is going to reduce the amount of exposure, then almost by definition, that reduces the risk of a virus to humans. And similar, the availability of proven effective control measures, the EG in this is culling, but that could, of course, also include vaccination. And the infection in animals, the potential for exposure between infected animals and humans. So again, all of these factors go into scoring the risk for a virus to human health, it's anticipated that successful vaccination will reduce all these. So again, by definition, a successful vaccination program will reduce the perceived risk of a virus for humans. I should also note that actually going back to the previous, these elements are actually given different weightings in the final score. And these two elements are actually at the bottom of the likelihood elements in terms of weighting. So even if we're all wrong and this was actually to flip and there were to be some silent spread of a virus, slightly increased exposure, the actual impact that has on perceived risk from the human perspective is actually fairly low. The other side of this, of course, is, that potentially maybe more likely is the fact that, a virus circulating in a population that has a little bit more immunity than it had before. There is a possibility, well, again, Les's point is that you've got to have circulation of a virus for this to happen, but let's assume there is some circulation of a virus in these environments, that there would be a little bit faster antigenic, potentially evolution of these viruses. And how would that impact public health activities? It really impacts at most, I think, in the area of pandemic preparedness. But luckily, I think there are actually systems in place to monitor this already. We've heard this discussed certainly in the from the OFLU perspective in terms of the AIM program, again, to monitor the evolution, the antigenic and genetic evolution of these viruses for vaccine, or not, I guess for AIMS, not necessarily for vaccine, but in the human health perspective, we do this, as David briefly mentioned, twice a year. So in the context of the vaccine strain selections for the human vaccine, we spend a day discussing the data, presenting data that's available for the antigenic and genetic properties of some of these viruses that are of perceived risk. And this is a very much a collaboration between human and animal health, with OFLU playing a leading role in this as well. The idea being, and this is just a timeline of a vaccine response to an emerging event. And we know it takes time to make vaccine. It takes upward of 6 months in the human sphere to make a matching vaccine. And so the other idea being here that if we can get a little bit ahead of this, if we see a virus that's circulating in an animal reservoir that we think is potentially of risk to human health, we'll go ahead and do the first component of this, which is actually to make the vaccine virus, put it on a shelf, and hope that it's never needed. But should it be needed, then we're sort of ahead of the game a little bit. We've shaved some 4 to 6 weeks off this. So there is already a system in place within the public health network to monitor the evolution of H5 viruses. And so I think, even if more widespread use of vaccine in particularly poultry or other avian reservoirs is done, and it does change perhaps the speed of antigenic evolution of the virus, even that is manageable from a public health perspective. The systems are in place. I think, with, as we've just heard from other panelists here, if there are more intensive surveillance activities put on top of a vaccination program, I think there's even the opportunity for this system to improve as well. So more information coming into the public health arena with which to make these preparedness activities. So I guess, and one point here, Les has already mentioned this as well, this sort of the H79 success story, where a bunch of human cases, vaccination and poultry was initiated, of course, admittedly along with other intervention strategies, but subsequent to vaccination has only been a handful of human cases. Of course, H5 also circulates in China. There's also a vaccination program, and the number of human infections with that haven't reduced necessarily either. But I certainly thought and searched hard. I don't know of any examples where the opposite is true, where vaccination programs in animals actually led to increased risk of humans or increased risk. So certainly I think this would be, and from a public health perspective, sort of the ultimate goal, but certainly anywhere between where we are now and this would be a movement in the right direction. So to conclude, in terms of the spread, I think the conclusion really has to be that increased vaccination of birds with robust programs that we're all talking about will lead to lower public health risk. I don't think there's any argument there whatsoever. And that's primarily through this limiting or altering the exposure of people to the virus itself. In terms of immune pressure, I think one point I haven't touched on there, from the perspective of a virus circulating in a population with different immunity, there's absolutely no expectation that that would actually change the inherent risk of a virus to infect humans. Adapting to that environment certainly wouldn't force that virus to change in a way that makes it more infectious to humans. And the other way, potentially it may change this antigenic evolution, maybe, perhaps maybe not. But I think we can be all assured that the systems are in place to monitor this. Unfortunately, those systems can always do with improving, but I think this is also an opportunity as well, that with continued and even enhanced collaboration between veterinary and human health, that we can do a much better job of this. So I think, again, simple answer to the question is, in the context of human health, vaccination of birds has to be a good thing.
Thank you.